Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Nita Valens.
Well, hi there, Dr. Darrow.
Hello, Nita. You make me smile.
Aw, we're very
Remember
happy
that song?
doing this.
You
Yes.
make me feel so nice. Do 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 do.
Oh my gosh, you're going to sing today. That beats jokes. I like it. Keep singing.
So what's going on with you? We're going to get to a great show and teach people how to
let's,
heal
let's help people
their
heal
orthopedic pain without surgery. I want to tell a story right now, if you don't mind.
Okay.
I'm going to give out the phone number first because we want to get callers.
Yes.
And with the calls, anyone who calls and gets a free copy of my book, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. So this is a book that Suzanne Summers wrote the foreword to. I'm showing a picture of that to the camera right now. And Suzanne Summers, we do love you so much. Suzanne is a great advocate for medicines that help people instead of medicines that hurt people. And what I've run up against my entire medical career are doing surgeries that hurt people. I'm not saying surgeons are bad. Surgeons are great. It's just that most of the surgeries that are done in orthopedics, in my humble opinion, should not be done. So if you're interested in this subject, give me a call right now. The number here, live and local, as Dr. Jean used to say, is 866-870-5752. That's at the studio, 866-870-5752. And don't be shy. You can use an assumed name, pretend it's your father, your mother, your sister, your brother, and ask your questions about your joints, ligaments, tendons, anything from the back of the head down to the bottom of the feet. And we do neck, spines, arthritis, elbows, shoulders, muscle tears, knees, obviously. There's so many knees that are injured. They always say knees are the first thing to go. And I think we do get probably more knees than anything else. But there's no part of the body that really I don't inject when it comes to musculoskeletal pain. If you have pain from a stroke or something like that, using regenerative medicine of platelets and stem cells probably is not going to help with that, unless it's a musculoskeletal issue. If it's neurological, then this stuff is not really necessarily the answer. So I used to work at Rancho Los Amigos Hospital, Rancho Los Amigos. That's in Downey, California. And I was there for, 2 years or so, on and off, doing spinal cord injury and brain trauma. And a lot of those guys, once they got healthy, after the trauma of whatever it was, would do a lot of wheelchair athletics, and their shoulders would wear out. So we would use these treatments on them also. So just because you had a stroke or because you had a spinal cord injury doesn't mean this won't work. It just means I personally can't help the neurological aspects of it. There are centers where they're doing studies on this to help spinal cord injury. I don't do that stuff. So again, give me a call right now, 866-870-5752. Ask me your questions about your musculoskeletal pain. Boy, I'm talking fast today.
You are. You're excited. This is good.
I am. You cheered me up already, and I wasn't even uncheered to begin with.
That's right.
If you want to call my office and talk to people there are people by the phones at 800-300-9300. That's 800-300-9300. And the number, I should say the website, if you want to look at videos, watch videos of me doing these procedures, go to www.lastemcells.com, www.lastemcells.com, and you can email me from any page there. I get emails daily, nightly, all the time. and I answer every single one of them. So this book is a great book. I mean, I don't want to think I'm a great writer, but this took
it
me
is a great book. It's chock full of actual scientific studies.
It is. There's 256 studies in here, why regenerative medicine of platelets and stem cells does work, and why surgeries for orthopedics often fails. And the person that I was going to talk about came in, 2 days ago with a supposed ACL rupture in her knee. She's a heavy workout person and knows a lot of people in the surfing industry, so we had a lot to talk about. I'm showing a picture of Nick Lamb, who won the Mavericks contest at some point a few years ago, who was one of my patients. And I got to work on his knee and help him heal up. But I take care of tons of surfers, tons of golfers, basketball players, baseball players, really any kind of sport. Believe it or not, pickleball players are one of the top targets today for pain because it's a lot of people who are older who really beat themselves up. They're having so much fun. But anyway, this woman comes in. She's about 30 years old, really active. She complains about an ACL rupture in her knee. That's the anterior cruciate ligament that holds the tibia bone, the bone in the leg, to the femur bone, the thigh bone. And she's so anxious. I'm going to have to get a surgery. She's seen a couple orthopedic surgeons. They need to do a surgery right away, she says, and she doesn't want to get a surgery. So I did a couple of tests on her, did the examination, and I said, you don't need a surgery at all. Your knee is very nice and tight. And I doubt that you have an ACL rupture, at least recent, because her injury was 2 weeks ago. And I saw fluid in the knee with my ultrasound. I said, let me just take the fluid out. If it's red and it's blood, then maybe that ACL tore. If it's yellow, then it's not an ACL rupture, because ACL ruptures bleed a lot, okay? So we took the blood out. We took the fluid out. It was not blood. It was just yellow, perfect, synovial, clear fluid. And I said, you may have an ACL rupture. I doubt it, because her knee was really tight. But if you do, it's not recent. If it was recent, I would have taken blood out of the knee. Okay, I don't know if that makes sense to everybody. Nita, does that make sense to you?
Absolutely.
All right, good. So I take the fluid out, and I'm very excited for her. And I say, you either had a remote ACL tear, meaning long time ago when you didn't know it, or the MRI was overly sensitive. She had an MRI showing the tear. What does that mean? MRIs actually show things that aren't there. They're overly sensitive. And we see this all the time. We see, a surgeon will get an MRI of a knee, let's say, and say, oh, you've got an ACL rupture because the knee is swollen and painful. So they go and operate, and they go, whoa, the ACL is totally intact, and they sew the person back up.
Oh, wow.
So it's very, very common. This is not something I'm making up. This is very common. I've seen it over and over in the last 25 years, endless times. So anyway, the young lady came in yesterday for a stem cell treatment, and there was more fluid in there. And we aspirated the fluid, and then we put in the stem cells. And she felt better right away. I mean, it was pretty amazing. And she said, by the way, I think it was her aunt, is in the medical field, and she ordered a brace, an ACL brace for me. And I said, why? Those things are expensive. They're like $1,500, $2,000.
Oh,
it's
wow.
not going to help you. You don't need it. So too many people are dragged into things that medical people think are good for them when the medical person doesn't even know anything about it. I'm a doctor on the front line. I've been doing this for 25 years. And I'm not saying I'm any smarter than anybody, but I certainly know more than somebody who doesn't do this kind of work. And I hear all kinds of things. Stem cells can't work, platelets can't work, they can't grow tissue. But I see it grow tissue. I've seen before and after MRIs and x-rays where cartilage is actually grown. So I'm looking for your calls. I'm going to give out the phone number of the studio again. I would love to talk to you instead of me just blabbing along. And, and the phone number to talk to us live right now is 866-870-5752. That's 866-870-5752. Take this other number down also if you want an appointment or you want to just talk to someone at the office, which is 800-300-9300. And if you just want to email me, that's fine. The number to the, the www to the website is www.lastemcells.com. Every page has a spot to email me. And the nice thing is there are so many pages of studies there that will teach you, and you can give these to your orthopedic surgeon too. You can cut the stuff out and paste it and give it to them and show them their own studies, because even though these studies come from orthopedic journals, most orthopedic journals don't believe in this kind of work. They just don't believe in it. I don't know why. I fight with my orthopedic surgeon buddies.
Well, they don't embrace change very easily. And
Well, it's not they don't. Nobody does.
nobody does.
Yeah, I'm not blaming surgeons.
No,
I mean, I think,
but it's a new paradigm.
yeah, human beings are slow to change.
Very, very true.
And fortunately or unfortunately, I'm the opposite. I want to check everything out. I'm very open-minded, and I learn a lot from my patients. Sometimes a patient will come in and say, I tried blah, 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 and I'll go try it on myself if I think it's not going to hurt me. If it works for one person, it can work on a lot of people, right?
That's right. And you
All
have
right, so-
definitely worked this on your athletic body.
I have. It's hysterical. I mean, I have injected myself for 25 years. I self-inject, and the first thing was my right wrist. I injured golfing, hit the ground instead of the ball, and hyperextended it. And I used this on my wrist. The first shot that was given to me was at a convention about regenerative medicine in Las Vegas, and they were talking about wrists. And I said, well, I injured my wrist. Will it help me? And a doctor there said, yes, it will. And those were back in the days a long time ago when they were sugar shots. Remember, Nita, you had that on your neck?
Yeah, that's the treatment I had with you.
Prolotherapy, it used to be called. It works great, but not anywhere near as great as platelets and stem cells. So occasionally I have patients from 25 years ago that I did it on who come back and go, I want prolotherapy. And I go, what's the point? We have something now that's 10, 12 times stronger, 20 times stronger. And there's no point to do, in my thinking, there's no point to do prolotherapy with sugar anymore. Concentrated sugar causes irritation. And look, there's a lot of good doctors out there that still only do prolotherapy. But I can tell you, because I've experimented on my body, like everything else I experiment on in medicine, using prolotherapy versus PRP. And that injury was my left knee when Dakota, my 85-pound husky, hit my left knee from the outside full speed running in the dog park and loosened up my knee. And I did prolotherapy on it because it's easy. I just grab a bottle of concentrated dextrose and some lidocaine. I don't need any help. And I got out the ultrasound and I injected around the patella, that's the knee in front, all the way around I hit it about a dozen times to tighten up the retinaculum because the patella was coming out of place. And then I hit the medial and lateral meniscus and into the joint capsule. And I did that all myself. I did it about 10 times over the period of a few months, and each time I would do it, my knee would tighten up so I could go running, and then it would loosen up again. And then I thought, okay, this is working great, but not great enough. And then I had one of my staff draw my blood, and I did PRP. And honestly, the very next day, that knee was so nice and tight, and I've never had a problem with it loosening up again. I've had other problems with it from experimentation. As you know, I'm crazy experimenting on myself, where I injected some hyaluronic acid into it just as an experiment. and my knee, not just my knee, but my leg blew up like a balloon. And that took about 5 months. I was on crutches for a while. I don't give hyaluronic acid, HA, the rooster comb stuff to patients.
Right.
I never did, but I got kind of talked into it by a rep, and I thought, okay, I'll try it. And I'm not doing that ever again. I'm not using that stuff. And my orthopedic surgeon buddies, when I tell them what happened to me, they go, oh, yeah, that happens all the time to my patients. They get what's called an effusion, fluid in the knee. And I said, well, why do you do it then? Why don't you just do what I do? And they go, well, your stuff doesn't work. Well, that's going to be continuing for, with orthopedics for a long time, for a lot of reasons. Hospitals don't make any money from not doing surgeries.
That's true.
So it's a
dilemma.
I'm going to call it the medical industrial complex.
I like it.
Yeah, it's. I'm not going to say it's a crooked system, because I think the people are doing it are moral people. It's just they're in the culture of cutting.
They're in the dark ages.
Well, to me it is. I don't want to make it that blunt, and I don't want to put surgeons down. I don't. They're very smart guys, and they do the hardest work in medicine, and gals these days too. Back in my day, you didn't see. I'm trying to remember if there's ever any female orthopedic surgeons. I can't remember one. But today there are plenty of them, and there's some, in orthopedics you have to be pretty strong, and women are working out like crazy, just like men are now. So, God bless them all. So anyway, I think this stuff is amazing. I've used it on my right wrist, both my shoulders. I had stem cells all over the place that I've done to myself. And where else have I injected? I've done both my knees,
Should we give the phone number again also?
Yeah, let's get some callers out today here. Stump me with your questions. Let's have some fun. The phone number right now, if you want to talk to me live, is 866-870-5752. I'm going to give it out again, so run and get your pen and paper. 866-870-5752. And I'm also going to give out the office number again. That's 800-300-9300. We would love to hear from you. So I think it's time to take some questions.
Okay. I'll give the website while you find a question. The website.
Actually, I want to give out something else. We also do regenerative medicine on faces.
Oh.
Yeah. We can make people look better by growing back the collagen in their face. Collagen is the major constituent in cartilage, so it works in the joints. But our entire body is made out of collagen. Our blood has it, our hair has it, and all the structural components has it too. So when we inject the face, we numb it up first, and then it's called the vampire facelift. It's a non-surgical way of stimulating regrowth of the collagen in the face. Also can be used on the top of the head to thicken up the hair. We do a lot of that. And I don't know, I think it's just an amazing process to have people heal without surgery when they've been told they need surgery. Go ahead, you want to give out the website?
Yes, it's www.lastemcells.com. And you can email Dr. Darrow off of every page on the site, as well as see him performing the treatments on videos. Again, that's www.lastemcells.com.
So this is a pretty simple question. It says turf toe. Dear Dr. Darrow, I really appreciated your article regarding toe injuries and stem cell therapy. Now, article, that's probably coming from the book or from the website. I don't know which this person is referring to. I played D1 softball in college and experienced a turf toe injury. Now, this is something that, many, many years ago, almost 25 years ago, a football player named David Sloan came to me for. He played for the Detroit Lions, and he just needed to have another year of football before he could get his pension, so he was relying on me to heal his toe to get him back on the field. We did 3 treatments, by the way, and he did heal up, which was amazing. This person writes, unfortunately, despite treatment at the time, on the injury and rest. It has lingered on and off for the past 4 years since. And I want to say this about that. I've had people for 50 years of pain who have healed from regenerative medicine of stem cells and platelets. So don't think an old injury is a bad injury. It's not.
Okay.
It's just some of these things can last a lifetime. Typically, I would avoid positions that put my toe in a compromised position, i.e. lunges, and I would be fine. But recently, through a combination of running and snowboarding, the injury has flared up again. It gives me trouble conducting normal activities like walking. Based on this brief explanation, do you think stem cell therapy could potentially help what appears to have become a chronic injury in my case? So chronic just means time-wise. It doesn't mean good or bad. It just means it's been there for more than 3 months. Acute injury doesn't mean good or bad. It just means it's a new injury. Or are there other treatments besides surgery, braces, and icing that you would recommend? I really appreciate your time. Look forward to learning more. Thank you. God bless you. Yeah, I think that just hearing what you've said, that using platelets and or stem cells can heal up a turf toe. I get turf toes that I work on all the time. All of these different kind of injuries of the feet. I just did an ankle yesterday where a woman had a subtalar fracture and an anterior talofibular tear, and I worked on that, and she walked out feeling better. So when people walk out feeling better, that usually means that I've injected into the right spot. Because we have a touch of lidocaine mixed in, or if it's stem cells, ropivacaine that don't hurt the stem cells. And if they feel better right away, that means that the local anesthetic also got to the place that is generating the pain. So that's a good sign. So we see that very often. And this is something interesting. A lot of times people will come in and we can't tell where the pain is being generated from. One of the most common areas is the hip area because there's probably 5 or 6 different things around the hip joint that can cause pain. So what we'll do is we'll inject with a local anesthetic, and if the pain is gone immediately, then I know that I'm in the right spot. So if you have an area you're not sure, the doctors don't know exactly where it's coming from, then they can do what I call a lidocaine injection test. And they just inject the area. Usually the best way to do it is under ultrasound guidance, the kind of ultrasound that looks into the body, and then you can see where the needle goes exactly. Those of you that are getting injections, especially in the knee, hips, or shoulders without an ultrasound, that's a big, big mistake because the solution is not necessarily going into the right spot. So, Nita, anything for you to say? I hear you smacking your lips.
I would like to...
Let's go to Dee Dee.
I was trying to get that out. Thank you.
But I'm going to give out Dee Dee. I'm going to give out the phone number one more time for people coming in to the station right now, listening. The phone number to call us right now and hear Dee Dee's story is 866-870-5752. Dee Dee lives in West LA. You're 47. Your job involves standing. You have anemia, and you'd love my advice. What's the anemia from?
Hey, Dee Dee, are you there? Hello, Dee Dee.
Dee Dee, yell at us. We can't hear you.
Okay. Tell you what, Dee Dee, I'll put you on hold, and then
you guys
we'll
can
come
figure
back
out.
to you.
We can figure out what's going on.
Yeah. So, in the meantime, do you want to take another question?
The break.
Oh, yes. Okay.
Everybody stick with us, please. It'll just be a minute. During that minute, you can look up the website, www.lastemcells.com. You can give us a call here live at 866-870-5752. Dee Dee's light has lit up, so maybe we can hear her as soon as we get back from the break. We'll pick her up
right after the break.
Stick with us, Dee Dee. God bless you.
We'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.